beautiful. Are you one of the 10 million women or girls who have PCOS, Polycystic Ovarian Syndrome? Do you have irregular periods or no period at all? Do you know what's happening in your body? Well, I'm so glad you're here, because on today's episode of Apothecary Wisdom, we're going to be exploring PCOS and all the treatments so that you can live a really healthy, full life. And my name is Maria Chaudhry. I'm a licensed midwife, an herbalist, and the creator of Botanicals. We create nourishing herbal remedies for women and children, most notably menstrual health, childbirth, lactation, and children's wellness. And we're going to talk about PCOS today. PCOS is so common. And has a huge laundry list of symptoms that are really frustrating and really uncomfortable, and oftentimes confusing. And today we are going to talk a little bit more about it, because what PCOS is asking us to do is asking us to listen to our bodies and to recognize when something's not quite right. This ability to listen to our bodies and understand what's happening is essential, because honestly, half of the 10 million women and girls who have PCOS don't even know they have it. They don't know what's happening. They don't know what's wrong, right? And what I'm here today is to bring public awareness to this situation and to teach skills of listening skills to your body so that you can recognize what healthy looks like and what out of balance looks like. Because I feel like that's the biggest lesson, or that's the biggest gift that PCOS gives us, if we actually learn the lesson, is to create and cultivate a deep connection and relationship with our body so that we can recognize what's happening and then speak our needs and get care when we need help, and then we can create a life filled with really life-affirming self-care practices that just really bolster up our vitality. But if we don't really know what's going on, then we're not really able to do that. And what happens is we as women, we tend to just kind of deal with the symptoms instead of resolving the symptoms and fixing it. And so today I want to highlight and illustrate what the symptoms are and remind you that self-care is an essential part of your health care. And when you are thriving, everyone around you is thriving, and everyone is much more healthy when you're more healthy and balanced. Okay, so let's get into it. What is PCOS? I'm going to read this definition, because PCOS is an endocrine disorder, and it's where the hormones are produced in abnormal fluctuations, and it causes abnormal fluctuations in the rest of your body. Okay, so here is how it's defined. It's a variable disorder that is marked especially by amenorrhea, hirsutism, obesity, infertility, ovarian enlargement, and is usually associated by elevated luteinizing hormone, testosterone, and estrogen, which results in an abnormal cycle of gonadotropin release by the pituitary gland. So what is that in English? I'm like, what? What did you just say? Okay, so let's do this. The symptoms of PCOS, it'll be easier to start talking about the symptoms first. Okay, so one of the primary symptoms, the first symptom that most people notice that makes them look a little deeper and then discover that they have PCOS is that they have irregular menstrual cycles. Either they have irregular cycles that are too infrequent, too spaced out, or they're too frequent, or they don't have a period at all, right? So they look into it and they discover they have PCOS. The other symptom that they have is hirsutism, which is excessive hair growth. So we're females, right? And we have a female pattern of hair growth. And then there are males that have a male pattern of hair growth. And then when you have an elevated level of testosterone in our body, in our female body, we start to have a male pattern of hair growth. That's called hirsutism. So it's like little beardy or mustachy, or like down on your lower abdomen or shoulders. Just any place where males would have more hair, women start to grow that hair there too. That's because of the elevated testosterone. And then also, in relation to hair, some women start to lose their hair and start to have hair loss. And then other women experience a lot of acne. And so this acne is also a result of elevated levels of testosterone. Okay? Another thing that shows up is their areas of their skin get darker and start to have skin tags. So it's real common to see like a darkened area in the back of the neck of their skin, or in your armpits gets darker, or in your groin gets darker, and there's skin tags there. That's showing up because the person has an elevated insulin level. And so in relation to elevated insulin levels, another thing that starts to happen is women either have a real challenge of losing weight, or they're not able to lose weight, or they're just gaining weight. And no matter what they're doing, they just keep gaining weight. And a big part of that is they don't have control of their insulin levels. Another thing that happens is breastfeeding women have a huge challenge with PCOS, and their biggest challenge is to produce enough breast milk to sustain their breast milk levels. And then another challenge that women have is they have a challenge in getting pregnant. So I'm going to start to break these things down for you, okay? So just remember that PCOS is caused by an imbalance in your hormones, which are your chemical messengers in your brain and in your ovaries. We can go super deep and complex, but we're going to keep this brief and simple here. Okay. Essentially what's happening in your body, you have your pituitary gland. Your pituitary gland produces a lot of hormones. We're going to talk about two of them. One of them is called your luteinizing hormone, LH, and the other one is follicle stimulating hormone, FSH. These two hormones signal to your ovaries. Once the ovaries get the signal, they're like, oh, they produce estrogen and progesterone, which are female sex hormones. And then they'll produce a little bit of testosterone. And at the same time, your pancreas will produce insulin. That's all normal, healthy female anatomy behavior. But what's happening with the menstruation when a woman has PCOS? So let's look at a menstruation. And so Heaven's going to hold up a little piece of paper. Okay, so this is normal, healthy menstrual cycle. Okay, so you see the numbers on the bottom of the page? Those are the days of your cycle. And you see the number 14 is red, so that's right around ovulation. And then right around day 14, you see LH and FSH, they're like green, light colors. There's a big spike. It goes from a low level to a spike, and it comes right back down to a low level. That spike triggers the follicles in your ovaries to release the egg. That's called ovulation. Once that egg is released into the fallopian tube, that follicle in the ovary starts to get smaller, and that follicle is now called the corpus luteum. That corpus luteum stimulates progesterone. So the egg is released, progesterone is stimulated. If the woman does not become pregnant, the egg does not become fertilized, the corpus luteum starts to get smaller, and the levels of progesterone drop down, and then we start our period. If this woman conceived and that egg was fertilized, that level of progesterone would just keep growing and growing and growing, and that's called progesterone poor gestation, and that would support her pregnancy. So that's normal menstruation. So what's happening with a woman that has PCOS? So down on the bottom of your page, you can see that you have your luteinizing hormone and your FSH, your follicle stimulating hormone. And first I want you to look over here at the regular menstruation, and I want you to see how the luteinizing hormone and FSH are really close together and they're really low. There's like low levels, and then there's the spike, and then it goes back to low levels. But that's not what happens for PCOS. PCOS, you see how the luteinizing hormone is elevated and there's no spike. So when you already have an elevated luteinizing hormone and there's no spike, so then that means you did not ovulate. No egg was released. So if no egg was released, then you don't have a corpus luteum. If you don't have a corpus luteum, no progesterone was stimulated to be produced. If you have no progesterone to rise and fall, then you have no period. If you have no progesterone, then you're not going to be getting pregnant. Another piece of this is women with PCOS tend to have an elevated insulin level. When they have elevated insulin, that means when their ovaries make testosterone, instead of making a little bit of testosterone, they make more excessive testosterone, and that testosterone inhibits ovulation. So a few things are happening. Because of the luteinizing hormone and because of the testosterone, ovulation doesn't happen, so then no progesterone is produced. Okay, so that's what's happening in their menstrual cycle with a woman that has PCOS. Okay? So essentially, I just want to say that some women will have irregular cycles. So this doesn't have to happen all the time. Sometimes they'll have a cycle, and sometimes their cycle, like I said, will be real close together or real long, or they might not have a cycle at all. Okay, but so now I want to talk about what happens in your ovaries with PCOS. Can you show the picture one more time? So if you look down on the bottom of the page, you'll see on the regular menstrual cycle, you'll see there's a darkened area where there's a little follicle that's trying to get mature. And as the cycle continues and right before ovulation, that follicle swells up. It's trying to be the one that gets to be released. And then once there's the spike of the hormones, then the most mature follicle, the lucky winner, gets to get released, right? However, with PCOS, what happens is the follicles prepare to be released, but it doesn't actually get released, so those follicles swell up. And so that's why you have these cysts in your ovaries. And you can put the picture down. You can have lots and lots and lots of cysts, or a few cysts, and they can grow and they can shrink in size. The cysts in your ovaries in and of themselves are benign and are not a problem, and you do not need to remove them even if you have tons of them. The only reason you would need to remove them is if they're really big, bigger than 5 centimeters, or they're causing you a lot of pain. Like they're causing you some sensation that you need to deal with. Other than that, the cysts in and of themselves are totally fine. Okay? But then it makes people ask the next question, well, how does PCOS affect fertility? You have to remember, women that have PCOS have healthy, perfectly healthy uteruses, and they have perfectly healthy eggs. They're just having a hormone fluctuation, right? So yes, some women have a really hard time ovulating and getting pregnant. And other women, they get pregnant on their own just fine without any problem, without any treatment. if you're concerned about your fertility and you want to conceive a baby and you want to do this is what I would recommend. The first thing I would recommend is I would look into the fertility diet if you have PCOS, because this fertility diet will help you control and regulate your body weight and help you control and regulate your blood sugar, meaning help you control and regulate your insulin levels. You have to count your calories and your carbs and your sugar, but that's really important. If you want to ovulate, you need to control your insulin levels. Also, I would learn a lot about herbs and herbal remedies that can help you conceive and prepare your body for birth. And so we have one which is called Fertile Ground. Okay. And now if you're at this time in your PCOS journey where you're going to try to get treatment and understand what is treatment, what are my treatment options, what do I have available to me. If you go to the Western medical route, the most common treatment is, even there they will say, the best and most important treatment is your healthy lifestyle and your diet, controlling your body weight and controlling your insulin levels. That's going to be the first thing they say. And there's not a specific one test, but there's this whole picture of health that you have to take into accountability. So when you are communicating with your care provider, it's really important that you're as thorough as possible with all your symptoms, so they can look at your symptom picture and try to put the pieces together. And then they'll do a physical exam, right? They want to know what your blood pressure is, what your blood sugar levels are. They want to look at maybe do a pap, look at your ovaries. They want to check your hormone levels. And then once they get all the information, then they can diagnose PCOS. And then once you have all the information, then you have your treatment plan. However, the most common treatment plan is going to be birth control pills. Even if you're not trying to control or prevent a pregnancy, birth control pills are prescribed because they contain the hormones that help you ovulate, right? They can balance your hormones. They can lower the level of testosterone that's in your system. They can help regulate your period. And then they can also help prevent unwanted pregnancies. So birth control pills are the first thing that they tend to do. And then there is another medication that they would offer you if you're like pre-diabetic or type 2 diabetic or have elevated insulin levels. They'll give metformin. And so there are millions of women that are both on birth control pills and metformin to treat their PCOS symptoms. Now, those strategies and treatments are appropriate for some people, and then some people want to try some natural options at home, and they want to address their health, take their health into their own hands before they're at that level. Okay, you have to remember, PCOS is not going to go away on its own. You're going to have to address this in some way. And it's really important, that this is primarily a metabolic and endocrine system issue and a metabolic issue, and so you're going to need to address it with your diet and with your lifestyle practices. And like I said, it won't go away on its own, and if it's left unchecked and just left to just figure it out on its own, what it can potentially lead to is diabetes, which you don't want, which could lead to high blood pressure, high cholesterol, heart disease. None of that do you want. It also leads to sleep apnea and depression, right? So you can see how important this becomes. Okay, so you remember what I said before, it's insulin resistance and hormone regulation are your key factors. And if you've watched any of my videos, probably every video, no matter what the title is, every little tip and trick I give you is going to help support your hormones and your ability to regulate and achieve balance in your body. Okay? So you can manage all these symptoms with your diet, with your lifestyle, and with herbal supplements. Okay, and remember, you're a unique, wonderful individual, and there's not a one-size-fits-all treatment. So whatever helps your friend might not really work for you. Whatever diet is great for her, you might need to adjust and work for yourself. Okay, you're gonna have to find your own unique healthcare plan. Okay, but it always starts with your nourishment, your food, your diet. So you want to start by eating real food, by eating whole foods, unprocessed foods. These foods are free from artificial colors, sugars, hormones, or preservatives. They are in the most natural state. They're closest to their most natural unprocessed state as possible. These are fruits and vegetables and grains and meats and eggs, right? They're organic. These foods grown without hormones and without preservatives are good for your endocrine system, and they help you better regulate your blood sugar and regulate your weight. You need to balance your protein with your carbs, because that's going to help balance your hormones and give you enough energy. And also PCOS has been described as this like chronic, low-lying inflammatory condition. So you might want to consider looking into the anti-inflammatory diet, because the anti-inflammatory diet can help you reduce the inflammation. The other thing in terms of diet is really making sure you get enough iron and vitamins and minerals. So you want to get dark leafy greens. You want to get dark leafy greens. You want to have your nourishing herbs, like in Women's Balance Tea. Like that's your red raspberry leaf, your nettle, your oat straw. You want to drink plenty of those. Any like green supplement like spirulina or moringa, those are going to be really great. And chlorophyll is going to be really great, because chlorophyll can help move the lymph in your body. And your lymph system is really closely associated to your endocrine system. It's also going to help detoxify your body, oxygenate your blood, and it's going to help improve your iron levels, which is really important for PCOS. Some other considerations and supplements to think about and herbs to think about is cinnamon. So cinnamon is the bark from the tree, right? And they can make an extract from the cinnamon. And it's really good at insulin resistance and helping your body with insulin resistance. And it helps regulate your menstrual cycle. And then another supplement that's essential is zinc. So zinc is a trace mineral that boosts fertility and helps boost your immune system. And remember I talked about excessive hair growth and that dark coloring in the skin. If you have enough zinc in your system, that might help prevent that. Okay? And then vitamin D. Women with PCOS, most of them are deficient in vitamin D. They have low levels of vitamin D. And vitamin D is essential to your endocrine system, into your immune system, in your reproductive system. And it helps you regulate your menstruation, right? And helps promote ovulation. I want to remind you, like, if you choose to go through the medical route and you choose the birth control pills and the metformin, these herbs are compatible. They're complementary. It's just that when you talk with your care providers, let them know about everything that you're doing. And same is true when you talk to your acupuncturist and your herbalist and your naturopath. Let them know what you're doing so everyone's on the same page, and then you can get this wonderful collaborative care. Okay. So other herbs that are super helpful are adaptogenic herbs. And on YouTube, we have a playlist all about adaptogenic herbs. And I go into a lot more detail about one specific herb, which is ashwagandha. But the adaptogenic herbs are really good at balancing your hormones, because a person that cannot regulate their insulin, so a person with PCOS, has too much insulin, and then they have too much testosterone. And that's why they're out of balance. And adaptogenic herbs can help balance those hormones. So one of the best ones is ashwagandha, and it's been well known and well loved for women's health for a lot of different reasons. One is that it can help lower your cortisol levels. It can help balance your hormones, like I just mentioned. It can help you cope with stress. It can also help promote healthy sleep. And it can help regulate your menstrual cycle and promote fertility. Okay? Another adaptogenic herb is called licorice root. Now, licorice root is really wonderful. It's a Chinese medicine herb, so it's used in traditional Chinese medicine in tons of formulas. It's a real harmonizing herb. For PCOS specifically, it really helps with anti-inflammatory, and so inflammation, and then it helps regulate the metabolize the blood sugar, and helps regulate hormone balance, and helps regulate your blood sugar. So it's specific for that, and it's a nice sweet taste. And then another wonderful herb, which is not an adaptogen, is called chasteberry or vitex. Vitex often has these like incredible names, like the most incredible herb for women's health, because it's so loved, because it helps women that have really painful periods, really heavy periods, really long periods, or irregular periods. It helps balance and harmonize the body, so it helps with deficiencies and excess in your hormone levels, and it really just supports your female anatomy and reproductive system to prepare your body for pregnancy and for birth. And so vitex and ashwagandha are both in fertile ground, and they're also both in menstrual harmony. And another just wonderful herb for PCOS is fenugreek. Remember I said in the beginning of the video, breastfeeding women struggle with producing breast milk already. But then when you throw PCOS into the mix, they are really struggling to produce breast milk. And so fenugreek is going to really help them make ample breast milk that's thick and rich. And it's also going to help lower their blood sugar levels. So it's going to help with their insulin levels. So we put that in our Let There Be Milk to help support breastfeeding women who are struggling to make enough milk to nurse their babies. One thing I want to say though is, so licorice root, vitex, and fenugreek are not intended for pregnancy. Which is fortunate, because when you're pregnant, you don't really have too many PCOS problems, right? But still, don't utilize those herbs while you're pregnant. Okay, so what are the other key factors for helping you balance out your hormones? And you know what they are. You know what I'm going to say, right? It's going to say, okay, you got to move around and have good exercise. You got to control your body weight. You've got to breathe deep and move and stretch and get your blood circulating. And so gentle, low impact exercises like walking, hiking, swimming, dancing, yoga, tai chi, Pilates, qigong, all of those are going to connect you with your body and connect you with your breath and get everything circulating and help you maintain your body weight. And you can also be one of those girls that cycles for miles, and you can be a distance runner, or you can go to the gym 5 days a week. All that is really good for you. So go for that. In terms of Qigong, if you want to learn more about that, you can go to our sister website, pathwithharmony.com, and there's some videos all about health and relaxation that will help you in this time of your life right now. The next thing is really essential is good sleep hygiene. Getting enough sleep is paramount, is foundation. If you're going to create balance in your life in any form, it's going to come from sleep. And so when you have good sleep, studies show that it improves your mood, it improves your menstruation, it improves your fertility, balances your hormones, it lowers blood sugar, it clears your mind, it improves your cardiac health. We have a whole playlist on YouTube dedicated, committed to helping you get the best sleep you can. And then the other one, the easiest, the hardest one, it's easy to say, just reduce your stress, right? That's way easier to say than to do. If you want to release your stress, breathe deep, soften your body, and meditate, even for a few minutes every day. Once you can relax your body and meditate, and you practice that, you'll be able to quickly go into a relaxed state, and you'll be able to stay there longer. We also have a whole playlist of guided meditations for you. So you can, if you're like, I don't know how to meditate, just follow along. You'll be in good hands. The next one is massage. Getting a massage is really excellent, not just because it helps you relax, but it helps improve your circulation and it moves your lymph. Remember, your lymph is directly connected, very closely associated with your endocrine system. So all the things that I just mentioned, your diet, getting outside, all those vitamins and minerals, your herbs, your exercise, your movement, meditation, massage, all of those are life-affirming self-care practices, and when you do them in a relaxed state, they take you from a fight or flight place of stress, and they put you into a parasympathetic state. And when you're in a parasympathetic state, you can feel love, you can feel connection, you can feel at peace. And when you feel these feelings more often, you're cultivating these feelings in your body, it will improve your overall health, it will balance your hormones, and just improve your overall outlook on life. Okay, and we have a whole bunch of videos associated with that because I really want you to have a feeling of solidness and serenity in your life. This is why I'm here, right? So I'm going to start to wrap this video up, and I want to leave you with a couple things. Yes, PCOS is common, it's incredibly frustrating, and it's very challenging, right? There are options for you. You have to pick some option because if you leave it on its own, it's not going to get better. So you can go the medical route, you can do the self-care, life-affirming herbal route, whatever route works for you, do that, okay? And also I encourage you to find other women that are going through the same thing you're going through, support each other and learn from each other. And also be patient with yourself. Be kind to yourself and listen to yourself. Listen to your body. Your female body has so much wisdom and so many messages that only you can interpret. Take your time. Your relationship with yourself is the most important relationship that you'll ever have, right? And you're not alone on this journey. We're all in this together. And so, if you liked this video, I have to say it, push like and subscribe. Yeah. And until next time, my friends, drink deep and always walk in beauty.